Dr. Klein, I want to start with you. You're in the front lines in treating coronavirus patients, as well as being a public official in the Minnesota Senate. How do you kind of assess where we are in terms of potential innovation?
Well, thank you, Professor, and thank you for having me on. And I think the most sort of dramatic and telling one, which my colleagues will speak to, I think, is telemedicine, and I'll leave it to them to describe some of the innovations in that area. But one of the first things I noticed in the hospital shortly after the pandemic hit was that our occupancy rates for hospitalizations went way down dramatically and suddenly. And there were a lot of reasons for that, but one of the most significant was that we providers realized that the safest place for our patients to be was not in an institution. It was, in the privacy of their own homes, if possible, sequestered as they could. And I think that sort of drive to keep people safe and keep them healthy outside of hospitals may turn out to be a significant sort of shift in our thinking. Sort of aligned with that, Professor, is reimbursement systems that would reward that type of thing. Reimbursement systems that don't incentivize hospitals to get people into beds, but rather incentivize us providers to keep people healthy and keep them out of hospitals. And if we're able to we've known for years that we have to do that, and we've made some baby steps in that regard, but this may be the seminal event in our lifetimes that sort of drives us to that in a more progressive way.
Thank you.